thank you all that are here and are ready to go. And by way of introduction, my name is Kim Humphrey, and I'm the CEO at Parents of Addicted Loved Ones, and I'm actually sitting in our office here in Phoenix, Arizona. And we are really happy to have the opportunity to have Sean with us from the DEA. I'll introduce him in just 1 second. And I've actually heard Sean before and talked to him in the past, and I think we've actually crossed paths in my previous career in law enforcement. And so it was great to have him be able to come on and share with us some of the latest trends. And he really is the person that's in the know about what's happening, and it's really been a difficult situation these last few days, especially here in the Phoenix, Arizona area. And as people are checking in, I just wanted to share a couple things with you. You may or may not be familiar with, but in Arizona a few months ago, we had a 10-month-old that was exposed to fentanyl and didn't survive. And then yesterday we had another incident involving a 1-year-old that was exposed to fentanyl, and they used 3 doses of Narcan to revive the 1-year-old. We haven't heard the latest on their condition, and those were right here in town. And then, I got up today and it was going to be a normal day, and I was planning on being in here for this event as well as just being in the office, but my phone rang, and actually my wife and I were both receiving calls at the same time, and my wife answered the phone, and it was one of our facilitators from PAL, who also happens to be a friend that we've known for 5 years. She had literally just received a phone call from the local police department here. She was on her way and arrived at where her daughter had been working, and they had found her daughter had died at her place of work, and they had just found her. They found what appears to be fentanyl next to her, and this young woman, who I've known for the last 5 years or so, had been struggling and desperately trying to beat this issue. And unfortunately today, we found out that that wasn't going to be the case. So, I normally wouldn't want to start off a meeting like this, but I think it just shows the gravity of what's going on here, and how incredibly important it is for us to become educated about this and to learn, what it is that we can do about it, as well as just have a good understanding of what's really going on out there. And so again, I am very thankful that Sean is with us. And by way of introduction, Sean serves as the Chief of Community Outreach and Prevention Support for the DEA since 2015. That includes management of the DEA's museum, as well as the Community Outreach and Prevention Support section. In his capacity, Sean is responsible for guiding a diverse and creative staff to develop and implement strategic national partnerships with other organizations, which help educate the public on the current drug threats facing the country, also support the DEA field divisions, and implement DEA's Operation Engage, communicate key administration drug prevention messages, as well as help reduce the demand for those drugs. And so it's sort of bittersweet, Sean, but I am so thankful you're here. I think this is just tells us how much more important it is that we just get the word out. And I thank you for taking the time. This has been a long day for you, and I know that's it's tough, but I sure appreciate you. So thank you so much.
Kim, it's my pleasure and honor to be here, to have been invited by PAL to speak with you all and take your questions. But I do want to pause for a moment to remember the daughter of your facilitator, because it's truly what we're all about, what all of us working on the drug issue across the country, whether we are in law enforcement, prevention, treatment, or recovery, we're all working desperately to save lives. And boy, that really hits home when something like that happens. My sincerest condolences on behalf of myself and all of us at DEA. Kim, what I intend to do is first say hello to everyone who's here live. Good evening to those on the East Coast, and good afternoon to those on the West Coast. Certainly good day to those who are going to be watching this on demand in its recorded state. We're going to break this up into two parts. The first thing I'll do is walk everybody through kind of a 50,000-foot overview of what DEA intelligence is showing as the current major drug threats facing our nation. Then I'm going to pivot a bit and talk about some resources that we would like you all to be aware of that are free, that are science-based and evidence-informed, that you can share in your communities and with your neighbors and with your families and other parents. And then Kim will open it up for some questions at the end. Happy to answer them. I promise you now that if I can't give you a direct answer to your question, I will find out for you and get it back to Kim, and we can provide that. So we'll go ahead and get started. And the first thing I want to do is actually pause and bring greetings from the head of the Drug Enforcement Administration, Ms. Ann Milgram. She is our administrator, and she was confirmed by the United States Senate last June of 2021. For any of you who are joining us from the great state of New Jersey, you might recognize Ms. Milgram. She was the Attorney General for the state of New Jersey for a number of years. She was also a United States Attorney. So she is leading our efforts across the nation. And indeed, not only are we in 226 offices here in the United States, but we also have agents and employees in 70 countries around the world working against drug trafficking organizations. We're going to set this on the backdrop of the very, very sad numbers. This slide, actually, there should be a 105,000 right there in the center. I'm not sure why it's not showing up on our end, but sadly, we just got an hour ago an update from the CDC, and the total number of drug overdose deaths for the past 12 months ending in November of 2021. So for the 12 months from November of 21 back through to December of 2020, now over 106,000 Americans lost to a drug overdose. That equates to over 290 a day. 65% of those overdose deaths are related to synthetic opioids. The vast majority, both the red and the black on this slide, are opioids in general, and then the 30% are non-synthetic. So it is a tremendous number to be focused on, an important priority for us all to set this stage that 106,000 Americans, and the vast majority synthetic opioids like fentanyl, which, believe me, you will hear that F word a whole lot as we get through this presentation. So what's the grounding in what I'm about to walk you through? It's DEA's National Drug Threat Assessment. This is an annual document guiding North Star for DEA that we put together not only with our own intelligence from across our organization, but with literally hundreds and hundreds of state and local law enforcement departments inputting their local data and information so that we can paint a picture and take an assessment of the current drug threats that are facing our community. Here are some key findings that you've probably been reading on this slide as I've been talking to you, that Mexico-based transnational criminal organizations are the greatest drug threat to the United States. They control most of the US market. We're going to talk about fentanyl. We're going to talk about meth. We're going to talk about cocaine. We're going to talk about prescription drugs. We are still in the midst of an opioid epidemic that had its roots in prescription drug misuse. And then we're going to talk about the impact that COVID-19 has had on all of this over the last 2 years. So let's start by talking about transnational criminal organizations. And you say, boy, Sean, that is a mouthful. Frankly, we used to call these drug cartels or drug trafficking organizations. But as hard as it is to say, transnational criminal organizations is a true definition of what these folks are. They operate across multiple nations. They are involved in multiple criminal enterprises. The folks that traffic in drugs can also be found attempting to traffic in human trafficking and other products and goods and services, and even in money laundering too. And organizations, they are organized. They are incredibly organized. So let's talk a little bit about the four major groups that we are facing here in the United States. I mentioned Mexican groups. They are the folks who dominate the wholesale importation and distribution. In fact, there are really two drug organizations in particular that are the source of the problem in America. One is the Sinaloa cartel, and the other is CJNG, Cartel Nueva Generación, Jalisco Generación, CJNG. They are based in Mexico but have presence here across the United States. The second are the Colombian transnational criminal organizations. They are largely involved in production down in Colombia, and then they do business with the Mexico-based organizations to serve as the couriers of the product. Obviously, all of these groups are involved in making money, and with that money comes the ability to purchase weapons, communication devices, encryption technology, and perhaps equally importantly, the loyalty of proxy networks. And what do I mean when I say a proxy network? The domestic gangs, the violent criminal gangs that exist in American cities are serving in many respects as proxies of these transnational criminal groups, serving as the local distributors for the drug product. Those domestic gangs are opportunistic. They don't have any particular allegiance except what's going to bring them the most amount of money. And then, of course, they are associated with a lot of rising crime and violence rates across the country. And it's something that our DEA administrator has renewed our focus in the last couple of months in an effort known as Operation Overdrive, focusing on, in this case, 34 cities that are hotspots for rising crime and violence rates associated in large part to these domestic gangs. I can also tell you that making money, as we know, is their primary factor. Bulk currency seizures increased as COVID has begun to slow down. See, what had happened was that the COVID restrictions had hampered these transnational criminal groups from being able to put their ill-gotten gains, their drug proceeds, back down into Central and South America. And as things are opening back up again, certainly they're now able to convert their stockpile cash back into the financial system. We're also seeing a rise in cryptocurrency being used for the money laundering from drug proceeds. So it's not just about bags and bags and bags of cash anymore. Let's talk about opioids. We are talking about the rising opioid related overdose death. Again, about an hour ago, this slide was rendered obsolete with its 105,000 plus number. That is now 106,000. 287 people a day is now 290. But what is critically important is the reality that we've had a 30% increase in drug overdoses from year over year. And again, 75% of those overdoses involve opioids. 65% synthetic opioids like fentanyl. So a little deeper dive into the illicit opioids and heroin. The fentanyl market in the United States is increasingly supplied by Mexican cartels. And I want to take a quick sidebar here and make sure that you appreciate the difference between pharmaceutical grade fentanyl, because many of us might be familiar with the fact that you can go to a hospital and they could apply a fentanyl patch to your arm, or you might be given a fentanyl lollipop. There is a controlled substance that's actually legitimately manufactured by first-class pharmaceutical companies and is available by prescription for acute pain, not chronic pain, but acute pain. This is not the fentanyl we're talking about. The fentanyl that is gripping the United States right now is illegally produced fentanyl, which I'll show you some pictures of here shortly, down south of the border, and is being smuggled into the United States and entered into the drug stream. Fentanyl is the primary driver behind drug overdoses in the United States. 5 or 10 years ago, it was prescription opioids. That is no longer the case. You used to be able to say that, heroin by itself was a threat, but now we're seeing shipments of heroin from Central and South America that is laced with fentanyl. And seizures at the southwest border are increasing. Counterfeit pills. You may have heard recently in the news or perhaps from your local DEA office that the rise of counterfeit pills laced with fentanyl is an issue. Drug traffickers are taking advantage of the opioid epidemic in this country, where folks are seeking out pills that they think are OxyContin or Xanax or Adderall, and they're buying them on social media apps or on cash currency apps, and those pills end up turning out to be fake, not the legitimate pharmaceutical product, but they're being manufactured south of the border, and fentanyl or meth. Some pills that we're seizing contain meth, but most are containing fentanyl. There's two problems here. One is the population of individuals who are going out on the internet looking for what they think is a legitimate pharmaceutical product, and then they end up ordering the legitimate pharmaceutical product or what they think is the legitimate product, to have it shipped to their house, and it turns out to be fake. And so they are being duped into purchasing something that is laced with fentanyl or methamphetamine. That's one problem set. The other problem set are individuals who are actively seeking out counterfeit pills that they know they don't have a legitimate prescription for Xanax or Adderall or OxyContin, but they are looking for that product. They are ordering online. It is fake. They are receiving it, and they are also overdosing. Our number one threat concern is fentanyl. This is a lethal dose of fentanyl on the tip of a pencil. That is 2 milligrams of fentanyl. And you say, well, wow, that's pretty amazing. And it is. It is 50 times more potent than heroin. Fentanyl is 100 times more potent than the morphine that you would get at the hospital. To put it into context, I'll do a little show and tell here. We've got a typical sweetener packet, and I'm not maligning this particular product. It could be a pink packet or a blue packet or a yellow one. This happens to be green, but most of us have these in our homes, or we run into them at restaurants. Many of these packets feature about 1 gram of powder. That is 1,000 milligrams. To put that into context, then, if this packet were full of powdered fentanyl instead of a sugar substitute, if this were 1,000 milligrams of fentanyl, this amount of fentanyl would kill 500 Americans right here, 500 Americans. And when you hear about in the news where DEA or Customs or one of the other agencies will seize kilogram bricks of fentanyl in one seizure, that gives you a sense of the scale of just how much of this product is potentially deadly for Americans. It is unbelievable. Here's a couple of images for you. This is the inside of a perfectly legal and legitimate and first-class science-based pharmaceutical manufacturing plant right here in the United States of America. Following good protocols, good practices, everything is hunky-dory. This is where we want our prescription drugs to come from. These two photos are from an illicit fentanyl manufacturing lab down in Mexico. This is where the product is coming from that is killing far too many Americans on a regular basis, whether it's laced into fentanyl, whether it's laced into counterfeit pills or laced into any other drug of misuse. Not exactly clean, not exactly science-based, not exactly regulated. Lord knows what they're putting into these products. So what are some of the most common counterfeit pills that folks need to be aware of? And I mentioned them earlier: Oxycontin, Adderall, Xanax. There are others, but these are ones that are typically coming out. You would hear of Oxycontin, that's oxycodone. Sometimes you'll hear of Vicodin, that's hydrocodone. Xanax is alprazolam, and then Adderall is actually a stimulant, an amphetamine. It is not an opioid. But these fake counterfeit pills are widely available on the internet. So here's a juxtaposition at the top of the slide on the left. This is an example of an authentic 20 milligram Adderall pill. That's what you would get from the pharmaceutical company. On the right is the counterfeit of that pill. This actually is a 30 milligram Adderall, not 20. But as you could tell, the reality of the counterfeit is it's so very similar to the authentic. To the naked eye, you probably wouldn't know the difference. Most doctors and nurses probably wouldn't notice the difference. It would take a forensic chemist in a laboratory doing an analysis to be able to tell. Down there in the bottom of the slide, I'll ask you to think about it. That's two examples of a 30 milligram oxycodone pill. Can you tell which one is authentic and which one is fake? And those are to scale against a paper clip to give you a sense of the size of that particular pill. The answer is that the legitimate pharmaceutical product is the one on the right, and the one on the left is the fake. Again, very difficult to tell to the unknown consumer. Again, authentic on the top and the counterfeit below. Very realistic looking. Here's the other thing we need to be all aware of and sharing information about, and the other threat related to these counterfeit pills is access. I mentioned it earlier, available on these e-commerce platforms and social media. Anybody with a smartphone has the ability to go out and purchase these counterfeit pills laced with fentanyl. In fact, it's DEA's belief, our intelligence showing that Twitter, for example, is one of, if not the most popular social media site for drug traffickers to use as a means of getting to their customer base. In terms of access, it's also about language. And if you were not aware that the drug traffickers and those seeking these substances have developed their own language using emojis, well, guess what? They have, and it's much like Egyptian hieroglyphics. And if we're not familiar with the combination of these emojis, they are sending text messages between each other, talking about particular products, particular availability routes, timing, you name it. And so it is beholden on us to make sure that we are aware of the communications that are happening when we think maybe our young adults, our young people are sending innocent emoji chats. They could very well be trying to communicate about accessing substances. So, the bottom line is that we believe the drug overdose crisis is a clear and present public safety threat, public health threat, and national security threat. So I'm going to take a quick sidebar and say, what has DEA done about it? So last August, we launched a major nationwide law enforcement effort to go after the clandestine counterfeit pills. 1.8 million fentanyl counterfeit pills were seized in just a very short amount of time. It was enough to kill 700,000 Americans just from this one operation. That was 712 kilograms of fentanyl powder, 4,000 plus kilograms of meth, and over 650 kilograms of cocaine. The meth and the cocaine, by the way, also laced with fentanyl. We issued a public safety alert, and you're going, well, I usually hear those from the FDA when, you know, the bag of spinach in my vegetable drawer should be thrown away because it might be contaminated. However, DEA does issue public safety alerts. It's just very rare. The last time we issued one was back in 2015 as the opioid epidemic, opioid crisis was first beginning with prescription opioid pills. So in September, just 5-6 months ago now, we issued this public safety alert to let the public know about the alarming increase in the lethality and availability of these counterfeit pills. So we've launched an awareness campaign. If I could ask you all, this is my first call to action from this presentation. Please jot down the web address that's at the bottom of this slide. We've launched the One Pill Can Kill awareness campaign to try and raise the public's awareness of the dangers and accessibility of these deadly drugs online. Our bottom line message to folks: don't take a medication, don't take a pill that wasn't prescribed to you by a medical professional and filled by a pharmacist, because you just don't know what you're going to get anymore. It literally can be one pill. And then we want people to share that information. Tell friends, tell family. Again, take your medications as they're prescribed by the doctor, but don't go fishing for products where you can't and shouldn't. All right. So we'll certainly, I'm sure, have more discussion during the Q&A and conversation about fentanyl and opioids. Let me move on to some of the other drug threats that are facing the nation, and I'm going to start with methamphetamine. I mentioned it earlier. You may have thought that methamphetamine had gone away when the Breaking Bad show had ended, and that team of folks had gone off onto the horizon, but frankly, methamphetamine never really went away. What has changed is that back in the day, methamphetamine was being manufactured here in the United States in little mom and pop laboratories in bathrooms or trailers or hotel rooms. And you could get from a trip to Home Depot or Lowe's and a pharmacy and a grocery store, you could purchase what you needed to make methamphetamine at home. And the US government responded, in large part, by the way, due to some really powerful lobbying by parents who had lost loved ones to methamphetamine overdoses. And they said, we've got to stop this. And so Congress passed changes to the Controlled Substances Act to make precursor chemicals for making methamphetamine harder to get. Unfortunately, there has still been a demand for methamphetamine in the United States, and so manufacture has shifted south of the border, and the same drug trafficking organizations in Mexico who are bringing fentanyl-laced products into the US are also bringing in methamphetamine. So we very rarely see a domestic methamphetamine lab here in the US anymore. It's largely methamphetamine brought in from south of the border. Okay, let's talk about cocaine, a product that has been around for a very long time. But frankly, guys, it is readily available in the United States today. Cocaine-related overdose deaths have been going up. They have not been going up at the same rate that fentanyl-related overdose deaths have been going up, but they have been climbing a bit. So, it's on DEA's radar as a concern. Seizures have been going up, seizures of the bulk shipments of cocaine. And then when we look at our data from Colombia and other South American countries in that zone where cocaine grows, production is higher today in South America. Cocaine, the growing of coca and its conversion into refined cocaine is higher today than it has ever been in the history of the data and tracking. So when you think of Pablo Escobar or the Cali cartel, and you think of that being the height of the cocaine cowboys and the streets of Miami, production today is actually greater. The difference, of course, is that the US is not the only market for South American cocaine. We're actually seeing seizures of South American cocaine all over the world, and the price point is actually higher in other parts of the world than it is here in the United States. All right, marijuana. Marijuana remains an illicit controlled substance according to the Controlled Substances Act, regardless of what individual states have done with either self-described medical marijuana or recreational marijuana. It is the most commonly used illicit drug in the United States. One cause for concern is that the level of THC, tetrahydrocannabinol, the psychoactive ingredient in marijuana, is increasing. This is not the marijuana of the 1970s and early 80s. So the rise of potency has actually spurred some states to introduce regulations on THC content where the state had previously gone and allowed for medical marijuana or even recreational marijuana. So they're having to pull back and say, hey, we've actually got to regulate THC because it can be so high. It's being grown on public lands to the detriment of the environment. There are reports of marijuana being seized laced with fentanyl. The seized marijuana tests positive for fentanyl. By the way, we don't believe that that's intentional by the drug traffickers. It's cross-contamination because the marijuana is being shipped along with all the other products. The issue with Mexico is they are a major source, even with the legal state level efforts going on in some places. And in fact, Cuban-based drug traffickers have actually established a presence in Colorado since that state changed their laws in order to take advantage of the demand, if you will, for marijuana in that state. So we continue to keep our eyes on that. At the bottom line, frankly, on marijuana is DEA is going to follow the science. And when the science and our colleagues at the Food and Drug Administration say that smoking a product is medically viable, then perhaps we'll change it. There are pharmaceutical grade products that contain some of the components of marijuana that don't involve smoking it. But again, we can talk about that for a long, long time. We're going to talk about prescription opioids. And again, I talked about it briefly earlier, controlled prescription drugs. They continue to remain available throughout the United States in illegal markets, despite the shift over from fentanyl. The abuse levels and deaths, which had, frankly, here was a good, we all thought we had a good news story in 2019 because controlled prescription drug use, prescriptions written, and overdose deaths had stopped going up. And then COVID hits and they started climbing again. It is the second most misused illicit substance, controlled prescription drugs, second most misused after marijuana. Again, the abuse had decreased. It remains at relatively high levels, but now again we're seeing an uptick, largely because of COVID. Hydrocodone products, by the way, are the most commonly misused pain relievers, and the Substance Abuse Mental Health Services Administration, their research shows the #1 source for misused controlled prescription drugs is the home medicine cabinet from friends and family and relatives. So it makes it incredibly important that when someone has a prescription for a controlled substance, a controlled medication, to safeguard it so that it doesn't fall into hands of individuals who might misuse it or divert it into the black market. Which brings up National Prescription Drug Take-Back Day. Here's call to action item #2, if you don't mind, please. Write down this date, April 30th, Saturday, April 30th, coming up in just a couple of weeks, from 10 a.m. to 2 p.m. local time across the country. There will be thousands of take-back locations open for folks to anonymously turn in their unused or expired medications so that it doesn't fall into the hands of folks who would divert it. The other nice thing is it doesn't then tempt the individual to flush it down the toilet, which has environmental concerns and environmental impacts, or throw it in the trash can where someone else might pick it back up. So if you wanted to go to DEATakeback.com, That website allows you to put in your zip code, and it will find for you the closest take-back locations across the country. If you're looking for something to help us do more than just participate on the take-back day, please encourage community folks in your area to help establish year-round take-back locations. Some pharmacies do it year-round. Some doctors' offices do it year-round. Some police departments do it year-round. Some community centers and civic government centers do it year-round. When we can make the disposal of prescription drugs as common as putting a seatbelt on when you get in the car, that's when we truly turn the tide against prescription opioid misuse. Because again, it's coming from the home medicine cabinet, and if we can get rid of it when we're done with it, fantastic. I'm now going to pivot, as I keep an eye on the time, Kim. I want to pivot and talk about resources that DEA has available to you. So again, in the past 20-25 minutes, I've talked to you about each of the major drugs of concern as DEA sees them now in early 2022. Now let's talk about some resources that we have available to you. And I know these are some websites that you may or may not be able to write down right now, or Dinah, if you wouldn't mind maybe sharing them in the chat box. There are 4 of them. If you're already familiar with them, fantastic. If you're not, please take a moment in the days ahead to take a look. I'm going to start in the top left corner, and that's getsmartaboutdrugs.com. This is our website for parents and caregivers and educators that has a lot of great resources and information on it. In the top right-hand corner there, justthinktwice.com, our website for youth and young adults. In the bottom right-hand corner, campusdrugprevention.gov. And the reason it's a .gov is that the website is geared for health clinicians, professors, college administrators, coaches, folks who are working on college and university campuses across the country to prevent substance misuse on college campuses. So there's podcasts, there's documents, there's publications, there's research materials that help support prevention work on college campuses. And then the last one is in the bottom left corner, operationprevention.com. About 5.5 years ago now, almost 6, DEA partnered with Discovery Education, a subset of the Discovery Channel, to develop operationprevention.com. These are a series of science-based, evidence-informed lesson plans for teachers, activities for students, a parent toolkit, virtual field trips. We take kids to the DEA Special Testing Laboratory to learn about forensic sciences and the analysis we do of drugs when they come in for sampling, so that we can understand what drugs are out there and how potent they are and where they came from. We go to Huntington, West Virginia to look at how that community, parents and teachers and police and fire department and elected officials are pushing back against the opioid crisis to make that community more resilient and successful. We have added to it workplace resources. So if one of you is interested in using the workplace materials to give to your employee assistance program at your workplace, they can use that material to help raise awareness and education about the science of opioids for employees, how to support employees who might be suffering from a substance use disorder, how to support them in getting them to treatment, and then keeping them in recovery and as an active member of your workforce. And then, of course, we have the opportunity for employees to then take that material home with them to their family and friends. Our most recent addition last year was a series of culturally designed materials for American Indian, Alaska Native populations. It's called the Good Medicine Bundle, and it uses Native American teaching styles and materials to get across the lessons of the importance of leading a healthy, drug-free life. So again, Discovery was already in classrooms across America with digital textbooks. They had nothing on the drug issue. So this was an opportunity for DEA, with help from SAMHSA, with help from the National Institute on Drug Abuse, to provide that material, and it's all free. The teacher doesn't have to pay for it at all. So please take a look. All right, websites are behind us. Now, publications. Yes, we still put together publications in this digital age. You can still get paper, and there's still an opportunity for paper. However, in addition to the paper materials, we also provide these publications in digital form to share with folks on email and on social media. These 4 examples on the screen, excuse me, are literally just 4 examples of the different publications that we have available for you guys. This is the next call to action down there on the bottom of the slide. Excuse me, getsmartaboutdrugs.com, pardon me, /publications is where you can go to download these materials. We have many of them, both in English and in Spanish. Drugs of Abuse over on the left-hand side is kind of our flagship publication. We've been doing it for, gosh, 20 years. We update it every 2 years. So what we have right now is the 2020 edition. The 2022 edition will be out later this summer. Right there in the middle, Prescription for Disaster, How Teens Abuse Medicine. Next to it, our publication that we do in partnership with the U.S. Department of Education, Growing Up Drug Free, A Parent's Guide to Substance Use Prevention. Actual, how do you, not instructions, guidance for how to have a conversation with your kids, whether they're, and guidance at the elementary school level, at the middle school level, at the high school level, and at the collegiate level. And then over on the right-hand side, that's a fact card for heroin. We have a whole assortment of fact cards and fact sheets and a whole host of other publications. Again, please feel free to take advantage of those, share them. There's also contact information on the website. Should you want bulk quantities of hard copy to give out, we can ship those when we have enough advance notice. The other resources that we have are partnerships, and I'm delighted to have been having conversations with Kim to add PAL to our list of national partners across the country. These are like-minded organizations that are working across silos, whether it's prevention, law enforcement, intervention, treatment or recovery, public health, public safety, to work together in partnership to spread the word and to share information and resources. Another resource for you, because as much as I am delighted to help you guys from here at DEA headquarters in Washington, D.C., our network of offices around the country are available to you to make local contact. If, for example, you in Oklahoma City would like an opportunity for a local DEA agent to come and give a presentation to a PTA or to a Rotary Club or to talk to the Chamber of Commerce about the local issues in Oklahoma City, the web address down there at the bottom, dea.gov/divisions, gives you contact to each of the 23 field divisions color-coded here on the screen across the United States. So again, please take advantage of those folks. The DEA Museum is a resource to you in a couple of different ways. We just finished a 2-year renovation. It actually happened to coincide with COVID, which was a good thing, but we've just reopened around Thanksgiving. If you find yourself in the Washington, D.C. area in the months and years ahead, that's a physical location for you to visit with your groups and learn about the history of the drug issue in America, the science behind these various drugs, how we've gone through different cycles in history of misuse, rising addiction, and then battling back against the problem and going into a lull. The forensics behind them, how treatment actually works and the science behind it, that people recover, and then a bit about DEA and the history of our organization. But the web address, if you're not going to be physically located or coming to Washington, D.C., there are virtual lectures and programs on the museum's website. There's virtual exhibits and also a junior special agent program for kids and other downloadable materials. So Kim, I've ran a little bit longer than promised. I apologize for that, but I know we're going to have some time here for questions and answers. I wanted to provide some contact information for DEA headquarters should anybody want to reach out to us in the weeks and months ahead. And then again, please remember that there are local field offices close to you. With that, I want to close by, Kim, thanking you for the invitation, and Dinah for all the help over the last couple of weeks preparing for this. And I want to salute PAL, its board of directors, and every one of the volunteers and facilitators around the country who every day are making a difference in the lives of Americans who have suffered through or are suffering with all of the various issues related to substance misuse. We at DEA are working as hard as we can to make communities safer and healthier, and we salute you for everything you're doing, and we look forward to finding more ways to work together. So Kim, I'll turn it over to you, and thank you.
Thank you, Sean. I sure do appreciate that. And, obviously it's that working together that's the key on all of this. And we just want to be another piece of the solution. And as we kind of wrap things up here, we've had a few questions come in, and I want to kind of take the ones that I think are the most universal ones. And you sort of talked already a little bit about the issue with fentanyl, and you showed the difference between a real lab and where these are manufactured, and that plays into this issue, and maybe reiterate this whole idea of, okay, why are people dying from this, and doesn't that seem counterintuitive to people that are distributing these drugs?
Kim, it's a great question. If I had $1 for every time I have been asked in the last year, why are drug traffickers trying to kill their customers, I would be a very wealthy person. The fact is that the drug traffickers are not trying to kill their customers. They are trying to hook their customers. They know how addicting fentanyl is. The sad reality is that it's bad science and bad manufacturing down in these jungle manufacturing labs that is causing the problem. The drug traffickers are attempting to place just enough fentanyl in each pill or each dose of cocaine or each dose of heroin to hook that customer that much faster. And the fact is that they are manufacturing these products, some in like those large cement mixers that you can rent at a rental place, or literally in lines of home blenders. And they're blending these powder products together. And I guess the analogy I would give is like making chocolate chip cookies. If you don't mix the ingredients properly, some of the cookies are going to have too many chocolate chips in them, although I don't think there is such a thing as too many chocolate chips. And then some of the cookies won't have hardly any chocolate chips in them at all. So some of these pills coming out of these clandestine laboratories have no fentanyl in them. And some of the pills have way more than the 2 milligrams of fatal dose that will kill the average American. And it's literally playing roulette as to which of the pills the person is going to take. But it is not intentional. It is just bad manufacturing.
Yeah, and on that same vein, you talked a little bit about, obviously the lethality of it, and not to, take pills that you don't know anything about. But depending on the form of these drugs and everything else, I know a lot of people are being warned about even just touching them. And obviously we have children, and I've mentioned that. And so maybe you could talk just a little bit about the fact that, why these things are so potent, and the fact that even just sometimes touching is a bad plan.
So actually the science has evolved, because when fentanyl first hit the scene, the worry was that first responders and emergency personnel who are just responding to an individual who is in the process of overdosing may themselves get exposed with dermal tactile touch. That has been largely debunked. There's still obviously the importance of wearing medical gear, but certainly inhaling the powder, or getting some of it in your mouth in the process, is absolutely deadly. Again, it's the chemical structure of fentanyl. There's even a variant of it that was widely talked about a year or two ago. It seems to have backed off a bit, called carfentanil. And if you've heard of carfentanil, again, in legitimate use, it is an elephant tranquilizer used at zoological parks. However, it was being entered into the mainstream drug market, and carfentanil is 100 times more powerful than regular fentanyl. But again, I'll reiterate, regular fentanyl is 50 times more potent than heroin and 100 times more potent than the morphine that's administered in a hospital. So that small quantity, that's easy to traffic, that's easy to disguise in something as small as a pill or in a small quantity of powdered cocaine or crystalline methamphetamine, makes it very, very easy. And it's all synthetic. I didn't even mention this, and forgive me. The chemicals used to make fentanyl are coming largely from China, some from India, but largely it's from China. And up until recently, the Chinese were not regulating these precursor chemicals at all, which made it that much more difficult. Kudos to the Chinese for taking steps to start down that path, but they certainly need to do more as well, and our administrator has called for that.
So just to reiterate, that whole issue, like we talked about, we've now had 2 small children. The problem is obviously if they touch that powder and then they, touch their mouth or do anything like that or get it in their nose,
In
that's
their
where
ears.
Yep.
You got it.
So clearly the message needs to be out that, this is not something, you don't want to be around this.
Yeah, and Kim, if I can, the 2 milligrams, that's a fatal dose of fentanyl. That's for an average adult American. That's not for a 1-year-old or an infant. You can imagine how small the dosage could be that could create problems for a young child. It's awful.
And that brings us to, being able to determine that. And I know there's these fentanyl strips that are out there. And I guess the question that came in is how effective are they at detecting lethal levels of this? And if so, how do you get a hold of them?
Yep. So yeah, so there's been a lot of attention in the last 6 months on the spreading availability of fentanyl test strips. In fact, the drug czar, the director of the Office of National Drug Control Policy, Dr. Gupta, talks about the science behind fentanyl test strips and the need to get them out more. There's government funding going out to the states and local organizations through grants to acquire them. DEA, that's not part of what we do. The best recommendation I can give for getting access to them is reaching out either to the state or the local health department in your community. They may already have quantities available for distribution. And the third recommendation would be if you have a local harm reduction coalition in your area, they are likely already looking at acquiring fentanyl test strips for distribution.
Thank you. And then, also, you already mentioned this, but maybe just reiterate, they're adulterating, meth as well as marijuana with this as well. Yes. And so we're seeing that as well.
Every major drug of misuse and abuse in the United States has been found with fentanyl in it, whether it was intentionally placed there by the traffickers or it was cross-contamination in the trafficking of the drugs from Central and South America to the communities of the United States where it's being sold. It is everywhere. And I can't stress enough the power of raising awareness about this as a prevention mechanism, that if you don't misuse a pill, then you don't have the risk of potentially having a fentanyl exposure.
And along that line is, the obviously social media, and you talked about how, the different ways, kids are trying to hide and use different things to try and keep people from knowing what they're up to. Is there any work going on between the DEA and these companies to try and somehow intercept this?
I can't go into a whole lot of detail because it's law enforcement sensitive, but just know that DEA does work with Snapchat and others to identify trafficking operations. We have called on those companies to do even more than they're already doing, and they are taking steps. Everybody should be doing more because, again, losing 106,000 Americans, mostly due to synthetic opioids, is unacceptable.
Yeah, and And I know you put up the different publications that you had, and I'm assuming that in there are some tips for parents of signs to watch for.
Yes, Growing Up Drug Free. That publication that we do with the U.S. Department of Education, it's about 20 pages or so, and that's got some really great basic information that everybody can understand, and it's also in Spanish as well as in English.
And a little different off the subject of these drugs that you talked about was a question about ISO, and if we're seeing more of that. I know it's kind of starting to come around, and then I
Yes.
haven't really heard a lot.
So in fact, we just got a fact sheet on it day before yesterday, and Kim, I'll send a copy of the information to you. It is catching some attention in the media. We are tempering that with the fact that in terms of a percentage of the total drug issue in America, it is but a very, very tiny sliver. But know that it is on our radar as a drug of concern. It has a similar potency to fentanyl. But again, it's not yet grown to the point where it's as big an issue as heroin, cocaine, meth, fentanyl, and marijuana. But yes, ISO is, you'll hear more from us on ISO in the coming weeks.
And just a couple more questions and we'll wrap this up. But
Sure.
Does the DEA have like a tip line or anything about, hey, I know where some illegal activity is going on,
Sure.
or drug
Yep,
dealers,
yep.
things like that?
I'm going to press gang Dinah into service if she's there in the office. I'll read the number off, and then if she can share it. So, and again, in modern day, it's not just the phone, but we also have a website where you can put the information in and remain anonymous. The phone line for tips on drug trafficking is area code 877. So it's toll free, 877-792-2873. And then the website address, dea.gov/submit-tip, dea.gov/submit-tip. And actually, if you were to just Google DEA tip line, it'll take you right to that website, web page.
Yeah, and kind of considering the fact that we started this off with kind of the tragedy of what's been happening, and at least one of the things that's out there is Narcan, and I realize that that this is something that is local to different places, but could you just talk about the fact that how do people go about finding that, and and the value of carrying that?
Well, yeah, if your first responders in your community do not already have Narcan, then you need to lobby the community government that oversees them to ensure that they have it. It is absolutely a vital tool for first responders. It is a vital tool for folks who think that they might encounter an individual who is in the process of going into an overdose on any opioid. Yes, if it's a fentanyl overdose, it will take multiple doses to revive that person, but it does work. There are community anti-drug coalitions across the United States who are in the process of getting it to more and more organizations out there. There is grant funding available from the Substance Abuse Mental Health Services Administration, SAMHSA, to acquire Narcan in communities. So the lack of funding should not be what holds that up, because it is a tool to help save lives.
Let me just ask you this as the last question to kind of wrap it up, and it's a kind of a tough one, because I spent 32 years in law enforcement, and I know that I saw many changes, and it seemed like it was a never-ending battle. It was like you deal with this, and then the next thing comes along, and now we're dealing with these deadly drugs like fentanyl. And do you have any thoughts about hope, about the long-term strategy, about how do we
Yes.
wrap our heads around this?
That's a great question, Kim, and I'm going to tell you the God's honest truth. I go to bed at night every day with hope, because every day I encounter youth organizations, parent organizations, community organizations who are saying enough is enough. We need to push back and make a difference. And when, as a student of history for our work with the DEA Museum, when you look back in time, America's struggles with substance use and substance misuse is not new. We've been having these battles going back over 150 years, and we have had victories and moments where we have tackled the issues. And then sadly, we looked away. We developed generational amnesia. And if we can push back against this and at the same time build up those resiliencies in the community with addressing the risk and the protective factors that help young people to grow up healthy and drug-free. Absolutely. I mean, when you look at the national data, the number of youth using drugs is dropping in the country. That's fantastic. The problem is that we are losing more people that are doing drugs, misusing drugs, because the drugs are so incredibly dangerous and deadly. So there is a silver lining, absolutely. There are fewer young people using drugs, and that does give me absolute hope. We've got better science than we've ever had in decades on what drugs do to the body and the brain, and the medication-assisted treatment that can help people that need the treatment. We have billions of dollars being pushed into law enforcement solutions, prevention, treatment, and recovery efforts. I don't think it's a question of whether we will or won't get past this very difficult moment. It's just a matter of how much time it's going to take and how many people are going to get involved in helping make it happen, which is why, and I'm trying not to be schmaltzy when I say this, but the work of PAL is so incredibly important. Any community organization that can help turn this tide needs to dig in, step up, and spread the word.
Sean, I can't thank you enough for taking the time to do this, and it was a wonderful presentation. It's needed. We need to get this out. Thank you for allowing us to record this. We're gonna put it out there for everybody so that we can just push this as far as we can and just get the word out. And for those that we didn't answer your questions, we'll take care of that offline. But the most important thing is just to say thank you and to let you know we appreciate the work that you're doing. We appreciate the DEA. We appreciate the fact that you're doing what you can. And I think together, I agree with you. There is hope, and we just need to continue to move forward and keep our focus on what we can do. And I think that's what we have to do. And and maybe tomorrow we'll wake up and it won't be the same, and I won't get the same phone calls, because it's just not. It's just extraordinary, and it just, in my lifetime, I just never thought it would be the way it is now. But you know what? Good work being done. Thank you. Thank you, everybody, for taking the time to tune in, and please help us get the word out and get those resources out that Sean talked about.
Thank you, Kim. And my best to everyone. Have a great evening.
Thank you, and good night.